Hello friends, we have started with a new chapter that is Occupational Health, and today we are learning ESIS, that is Employee State Insurance Scheme. In the previous lecture, we learned about pneumoconiosis in general and what are the types of pneumoconiosis and how to prevent occupational diseases. If a factory worker suddenly falls sick or get injured on the job, what happens next? Do they just get replaced? What happens to their family? That's where ESIS steps in. ESIS is an integrated social security scheme, and its primary aim is to provide comprehensive protection to workers and their dependents during times of medical and economic needs, whether it is sickness, maternity, or disability arising out of an employment injury or occupational hazard. The ESIS is designed to ensure that the affected worker receives not only medical care but also economic support during these times. It provides for certain cash and medical benefit to industrial employees in case of sickness, maternity, and employment injuries. Let us now understand how this system works. ESIS Act applies to the following industries: non-seasonal factories using power employing 10 or more persons, non-seasonal and non-power using factories and establishment employing 10 or more person in the manufacturing processes, shops, hotels, restaurant, cinemas including preview theater, road motor transport undertakings, and newspaper establishment employing 20 or more person, private medical colleges and educational institutions employing 20 or more person in some state. Employees earning rupees 21,000 or less per month are eligible to be covered under this scheme, and employees earning daily wages up to rupees 176 are exempted from making any contribution to the ESIS. The employees contribute 0.75% of their wages to the ESIS Act every monthly. The employers contribute 3.25% of the employees' wages to the ESIS. The state government contributes 1/8 of the cost of medical care, while the ESIS corporation bears the remaining 7/8. The ESI offers the following benefit: medical benefit, sickness benefits, maternity benefit, disablement benefit, dependents benefit, funeral expenses, and rehabilitation allowance. First, let us learn about the medical benefit. So, ESI offer 3 types of medical benefit. First is full medical care, which includes outpatient and inpatient care free of cost to the insured person in case of sickness, employment injury, and maternity. The whole range of required services are provided, which comprise of outpatient care, supply of drugs and dressing, specialist services in all branches of medicine, pathological and radiological testing, etc. The second type is restricted medical care, where only outpatient care is provided. The third type is expanded medical care, which includes full care short of hospitalization. So, how is it provided? So, if the services are given through the agency of ESIS hospital and dispensary, then it is known as direct pattern of service provision. It is given in areas with 1,000 or more employees. So there is dispensary with full-time medical or paramedical person. In areas with less than 750 employees, part-time ESI dispensaries are set up. If the residential concentration is scattered over long distance, mobile dispensary is set up. When the services are provided through a panel of private medical practitioner, then it is known as indirect pattern of service provision. The private medical practitioners are appointed as insurance medical practitioners. It is also called as panel system. The next benefit is sickness benefit. So when a worker falls sick and can't come to the work, they get cash payment to help them during that time. But to receive this, an ESIS doctor or an approved medical practitioner must certify that the person is really sick and unable to work. The benefit is payable for a maximum 91 days in any continuous period of 365 days or 2 consecutive benefit period, and the daily rate is 70% of the average daily wages. The employer cannot terminate a person from service during the period of sickness. There are 2 special type of sickness benefit: extended sickness benefit and enhanced sickness benefit. In extended sickness benefit, the benefit is given up to 2 years in case of certain chronic diseases to an insured person who has been in 2 years of continuous employment. The benefit is at an enhanced rate of 80% of the wages. In enhanced sickness benefit, the cash benefit equals to full wages for undergoing sterilization operation in the reproductive age group. It is 14 days for undergoing tubectomy or tubal ligation, and in males it is 7 days for undergoing vasectomy. Third is maternity benefit. ESIS provide cash benefit to insured women in 3 main situations related to pregnancy, that is confinement, miscarriage, and sickness arising out of pregnancy or confinement. For confinement, the insured women receive 26 weeks of paid maternity leave. For miscarriage, the benefit is paid for 6 weeks after the miscarriage. For sickness arising out of pregnancy or confinement, it is 30 days. Fourth is disablement benefit. The Act provides cash payment beside free medical treatment in the event of employment injury or occupational disease. If there is temporary disablement, 90% of wages are given as long as the temporary disablement lasts. If there is total permanent disablement and partial permanent disablement, in that case life pension on basis of loss of earning capacity is given, and that is determined by the medical board. If there is death of insured person due to employment injury or occupational hazard, the dependents are eligible for periodical payment. The pension is given at a rate of 90% of wages on monthly basis. An eligible son or daughter is entitled for pension till 18 years of age, and the benefit is withdrawn if the daughter gets married earlier. The wife gets pension lifelong or till she remarries. The sixth is funeral expenses. The cash payments are payable on the death of insured person towards the expenses of his funeral, not exceeding rupees 15,000. The last is rehabilitation. On monthly payment of rupees 10, the insured person and the spouse continue to get medical treatment after permanent disablement or retirement. Let me know your answers below. With this, we have come to an end of this lecture. If you found this video helpful, like it, share it with others, and subscribe for more.